बढ़ाते हुए I would like to call Dr. Avinash Singh Chauhan. He is founder and senior resident doctor of Shivaya Hospital, Unnao, and dealing in avascular necrosis the patients and curing the patients across the India also. He has achieved the National Achiever Awards 2021, Awards of Legend of UP by Deputy CM Shri Brijesh Pathak ji, Uttar Pradesh. He has also get the award by Shri Pushkar Dhammi ji, Uttarakhand. I would like to call Dr. Avinash Singh Chauhan. Please, sir.
So hello everyone. First of all, a very warm good evening to all of you. To all my respected doctors presented over here. Basically, I am feeling very honored to be a part of this CME. To be a part of this CME, it is a very interesting CME now I can say, because the first, it was very interesting topic which is given by a very respected doctor, Ahupolo. Thank you so very much for sharing your valuable experiences here. First of all, before starting, I want to say something with a one single shlok, that because I belong to Ayurveda, I am Ayurveda specialist. I am especially treating in avascular necrosis, spine disorder, joint disorder. So, first of all, I want to say one shlok of Ayurveda, that swasthasya swastharakshanam aturasya vikar prashmanam cha. The meaning of this shlok is the diseases which we are treating, the patient who is suffering from disease, firstly we are trying to stop the disease from the roots. That is the basic concept of Ayurveda. Because in front of me a lot of respected doctors are here, so before starting I want to just give me a permission, because you are very senior, so I want a permission. Give me a permission, sir, may I proceed please? Thank you so much, sir, because you all are very respected to me, and so I am now coming to my very interesting topic, the management of the spine and joint disorder through Ayurveda. What we are doing, so with this shlok I can see, you can understand the thing what I am trying to say here. So moving towards the next slide, that you can see, according to WHO, now see very clear, it is a very minor observation and a very important, interesting fact given by WHO. You can see here, almost 1 of 6 patient is suffering from arthritis nowadays. And on the other hand, you can see one of three family are suffering from arthritis. And if we talk about the whole entire population of India, almost 15 to 16% patients are suffering from arthritis. Now you can see the worsened part, because it is given back by the WHO, so we can't deny this. After that, what is the biggest issue here? Why the patients are going panic just because of the arthritis? So the biggest problem is nowadays is pain. Now pain is going epidemic right now just because of that arthritis. Patient only with the pain they are just going towards the consultant. After that, you can see India is a country of youth. We all know very well. But in India, almost 20 to 35 patients or youth is suffering from chronic and joint disorders. Can you believe how drastic it is? And on the other hand, almost 15 to 20% patients are suffering from chronic back pain. You can see easily. And one more thing, that bone mineral density, just because of that deficiency, patients are suffering from multiple fractures also. It is a very, very important component. Just because of that deficiency, almost you can see the numbers. Earlier it was 4,40,000, now it is going up to 6 lakh. It is forecasted by WHO. The result, the data which I am sharing in front of you, it is given by WHO. Some more interesting fact I want to share. The patient, they are just taking painkillers only just because of that degenerative disorder, just because of that back pain. They are not getting temporary, they are not getting permanent relief. Just because of that, they are taking painkillers. Now, what is happening? What the life is going to turn? Just because of that, these patients are converted into the DJD. Correct? You can understand with the slide. Easily you can understand. DJD means degeneration joint disorder. Degeneration or degenerative joint disorder. How it is happening? It is just because of that temporary relief, because life is very fast right now. And everybody wants to take quick relief. Nobody can see the permanent solution of the any disorder. So just because of that thing, patients are turned into the degenerative disorders. So what happened? It can easily happen in the hip joint in the form of a vascular necrosis, in the form of a spine disorders, in the arthritic form. If we talk about the knee joint, in the form of osteoarthritis, it is happening. So now, what happened? You can see in the spine cases also, number of cases it is increasing day by day. And it is happening, you can see the graph area. Graph also, 33,394 patients are suffering, at number of surgeries it is happening in India. It is a very old data I am sharing to you in front of all of you. And you can see the numbers also below 64 or above 84. The lot of patients are going undergo a surgical procedure of the spine. Moving for the next. You can see the number of surgeries which is happening. It is a very old data I am sharing in front of you. What happening after this? You can see that India is the largest or biggest contributor to the disability right now. It is forecasted by very top surgeons, and it is given by Times of India, and some more very reputed newspapers also, and that India will become a more biggest contributor of disability. Just because of that, why it is happening? Why we are not discussing this thing? The reason is lack of awareness. The awareness, if it is not happening, if we are not giving proper awareness to the patient, so it will happen and it will go in the worst scenario in future also. So what is the awareness we have to provide to everyone? That you have to do proper exercises regularly, you have to maintain the diet plan, and if you are very hectic by your schedule, so you have to maintain and you have to take some your work and you have properly you have to follow the exercises in regular days. So in the Indian Expressway, you can see almost 1990 to 2013. You can understand with the figures 537.6 million patients. It is going to 7,06,000 million in the both success. Okay. So according to Times of India, you can see India is the biggest contributor of largest contributor of replacements also it is happening in India, knee and hip also. And it will increase up to the 30% each and every year. Now moving to the next, a great leap is happening. Earlier it was almost 1994, so in 1994, 350 surgeries happened. Now it is going up to the 1.5 lakh. Now you can understand the figures easily. So what happening? In knee will be the pandemic and knee arthritis and the replacement it will be the pandemic in future. And after it is a prediction that given by the doctors, top surgeons that in 2022 the surgeries it will go up to the 1 million. So now with the graph you can understand earlier the cemented and non-cemented part. The blue one it is non-cemented part. It was not happening, but after 2006, cemented surgical procedure is happening, and doctors are providing. And the number you can see, the graph are increasing day by day, and up to the 2019, you can see earlier it was almost 250 surgeries. Now it is going 2,000 or 27,000. Next one, in the same way THR also. It is increasing and with the pie diagram you can understand. One more thing where I have to share to everyone because COVID-19, lot of things are changed after the COVID-19. Now it is very serious matter we need to discuss here. Earlier, the case of hip replacements and the disease of it was not there. But after COVID-19, things are totally changed. The cases are it is in the form of a vascular necrosis. That is my topic. I want to say to everyone, it is very severe matter. Earlier it was not there, but in the form of a vascular necrosis, lot of cases, it is in the market right now. Lot of patients are suffering from AVN. You can see in the pie diagram that 49% patients are suffering from AVN. That is the fact given by the doctors also. Top class surgeon and forecasted by Times of India also. Almost 10% patients are suffering from knee arthritis. So what is COVID-19? After COVID-19, the management which is given by the doctors is steroids. Just because of that, patients are converted into the avascular necrosis. It was the requirement given by the doctor. Steroid is a life-saving drug. Just because of the same COVID-19 patient, doctors given the life-saving drugs just to save the life of the patient. It is true, and I am appreciating to everyone because doctors have become a god to everyone at the time of COVID. But what is the factors we need to discuss after the COVID? Lot of patients are suffering from another phase. Lot of patients are suffering from avascular necrosis just because of that steroids. It is given by the top class doctors also, top class surgeons, that it will hide, the number will hide if we are not getting very serious with it. These are the numbers. What is the steroids and all? Next, what is the vascular necrosis? I use a lot many times this name. What is the vascular necrosis? It is the lack of blood supply towards that necrosis area. There is the bone area. Basically, it is happening in the hip joint, but some more joints are also affected, can be affected, especially knee joints ankle joint, wrist joint, and shoulder joint also. You can understand with the degeneration what is happening there. Now moving towards because man belongs to Ayurveda. So what is the line of treatment? What I am doing here? So with the one stroke I will tell you that Ayurveda Vridhe Raktin Navaritam Prasanam Sandushi Raktam Tagyam Vasoditam. Earlier, lot of diseases were there, but the line of treatment, it was only Ayurveda. There was no surgical procedure happening in earlier days, but now it is happening. So why we are here? Because we are just going towards the legacy. Indian pathy, it is the Ayurveda. So we need to promote if the patient is suffering from severe disorder or in the early stage, we can recommend. So the meaning of this stroke is Vat Pitta. We all know about it. It's the basic concept of Ayurveda. Vat in the form, because it is a channel, blood is there, Vat is obstructed by the blood. Just because of that, it is happening in the form of avascular necrosis. We can correlate in this way. So now, and one more thing I want to share my own experience that earlier, within almost 1 or 2 months before, I was in Dehradun camp. It was very successful. After that, lot of patients, they are calling me in Maharashtra. So within 5 days, I just suggested to everyone, my team, that just take a look what is the ratio of avascular necrosis. So you can see with the graph, easily you can understand, the bracket is almost 20 to 35 patients. And you can see with the pie diagram also, that is very interesting. You can see 78% patients are suffering from avascular necrosis. That is the data which is recorded by my team. And you can understand, within 2 minutes I will end. Okay, so you can understand what the management principles are there. Nidan Parivartan, that means the precautions we need to take here. First, that means we need to focus on the daily lifestyle and the basic things which are taking in the form of food and all. What is treatment and goal I'm doing here with the treatment that no cut, no injections or no medications. What is the factor? That the patient who took painkillers since last many years, but within 7 to 8 years in my hospital, I am doing the treatment and they are leaving their painkillers also. So that is my, you can understand with the things, what I am doing here with the help of Ayurveda. What is especially I am doing to improving the blood supply towards that necrosis area, and very important, we are just working on the process. The bone is getting decay, so we are stopping the decay process. After that, within 7 days, the painkillers, we are just suggesting that you need to stop painkillers from here. Now, second one, you can see the drastic change. It is came in the X-rays also. Within 7 to 10 days treatment, just say the patient name is 43 years age. You can see easily the change that is happening in the X-rays. The ball shape, and you can see the spaces, it was not there, but right now it is in very good space. More important, you can see easily that the pelvis, it is in very correct form. And one more thing I am sharing here, the Brijendra patient, 35 years, he was suffering from AVN second stage, but after 2 or 3 months, he took some medication, some treatment, and he turned into the third stage. But after that, he visited to my hospital. What happened? You can see the results in the form of MRI I am showing. This is the first MRI which I am sharing in front of you. You can see it was second stage. After some medications, second MRI, it is third stage. The patient turned into third stage. Now we can see the severity of avascular necrosis. It is increasing day by day. Okay. So now the best part is what I am doing here. You can see in the last MRI, the patient came to my hospital after third stage, and you can see the MRI. This is the patient picture. You can see, and this is the third MRI in the after my treatment. You can see easily no evidence of active vascular necrosis or bone marrow edema in the bilateral femoral head. It's the factor I'm sharing here because with the MRI you will understand and you will think about this treatment, what I am doing here. Because everybody wants to take some proof, and if you are giving some factors in the form of proof or MRI report, so definitely there is no hope, there is no day. You have to believe in that fact. So, going to the next. The patient, I treated a lot many patients from international also, from pictures I am sharing in front of you. That is, she came from Europe, Australia, and so many patients are there. What I am doing, what is the Shivaya Hospital vision, aim and vision? The Shivaya Hospital vision lies to treat such patients with the help of Ayurveda treatment and technique, without any cut, injections or any other medication. Without any cut, injections or any other medication. So I am just again repeating this word. And the best part is, earlier the patient was recommended to go for heavy surgeries, costly surgeries. Now they are living their life normally. And the best part is, their MRI reports have turned 100% normal, which I already mentioned that. So, that is the last one. If the patients are just believing in the treatment and the treatment line of treatment that which are given, so I suggested to everyone that you are going to lose your hope and you can say, I can heal myself, and if that in this way you can easily treat yourself. So now, thank you so much. You all listen my words very calmly. To all of you, I am very honored right now to be a part of the CME and respected doctors. Thank you so much. And any question if you have, you can ask me here. Thank you so very much, sir. It really means a lot to me. Thank you so much.
Any question and answers, please?
I am very junior to all of you in front of you. My career is started last, I think, 4 to 5 years before, and I am sharing my experience just because of that, my results. I am very confident that, and I know you all guide me in future also. I will be there, and if you are, because in front of many doctors, I saw they are my seniors, they are my well-wishers. So I am saying thank you to everyone for supporting me in every situation. Thank you so much, all of you. Thank you.
Thank you, Avinash sir, for your valuable talk. And it's true that India is becoming capital for diabetic and asthmatic patients. Thank you, sir, once again for your valuable talk. In the lecture series, I would like to call Dr. Brijendra MS ENT. He did his MBBS from F.I.P.M.